All right, breech delivery. Breech delivery. Anything other than head first is called a breech. So breech come in many styles. I would not ever say that breech deliveries can't be handled in the field, but they probably are not. If you see a breech presentation, transport should be foremost on your mind. Okay? Foremost on your mind. This may require surgical intervention to correct, but it's certainly something we do not try to correct in the field. Now, we can't stop what nature has started when it comes to delivery. We can pause, we can do some certain things, but we need to be transporting. If it's coming out, as in the butt first, a buttocks first presentation, it is delivery. And it may deliver, but what's different now that the butt's coming out, not the head? Can't see the neck, can't see the cord. The airway will be the last thing out, right? You can't suction, I can't clear, I can't ensure respirations. Limbs may be tied up. And what was the biggest part of the baby anyway? The head and the shoulders. And now that could be the last thing to come out. Ugh. All right. You have nice techniques today that I didn't have in the field. I never had to deliver a breech in the field, thank goodness. So you got some nice things out there now. We can FaceTime doctors. We have, there are apps on phones that are tied to the hospital where you can actually get an online consultation, and you basically could show the specialist what you're dealing with there. Maybe walk through it. It's kind of like you're the guy on the airplane and the pilot died, and somebody gets on the radio and talks you into landing the plane. Maybe it's something like that. But I'd rather just transport that person. Okay. Chas said, I can't get to that airway. I can't suction that airway. But if it comes on out and the airway is hung up in the vaginal canal, we have one of our rule breakers here. This is the point where I can put the gloved fingers inside the vagina. And what you're going to do, if the face is hung in the birth canal, you're going to insert your gloved hand and make a V around the baby's airway and push the vaginal wall away from the baby's face. And the little baby's nose and mouth is going to be right there. Are you going to be limited on what's going to happen? Sure. But at least you're taking appropriate steps to do that. Once this starts, you have to kind of keep that until the baby is went ahead and delivered. But we never go inside the vagina except here. This presentation is also breech, but it is called a limb presentation. You're probably not going to be able to deliver this in the field. Let me just say, you're not going to be able to deliver this in the field. Obstetricians can do some things to position and maybe to possibly turn the baby, but it's not a skill for us at all. And that's a nightmare when you check for crowning and you see a fist or a foot. It's just not going to come out correctly. Where in a normal delivery we would have the mom, and we would encourage the mom to push. In these situations, we encourage the mom not to push as much as possible. There is a very instinctful hormonal drive to push, but if you'll have her breathe through the contraction, just take deep breaths through the contraction and try not to push, you could delay it. You can position her to let gravity help you. So that's on their back with the buttocks elevated. They're telling you that because that's the best way to strap or seat belt a patient to the cot or the gurney or the stretcher. And that makes sense, doesn't it? But Chas, if you're lying on your back with a big gravid belly and somebody's got your buttocks elevated in the air, how well are you going to breathe? It's not going to be very comfortable, is it? A more physiologically correct position, albeit not a good position to be transported in, would be in the knee-chest position. So have her on her chest, on her knees with her buttocks straight up in the air. That would take advantage of the gravity to keep this off. But it's really hard to strap one of them in like that, strap a woman in like that. Another complication is the prolapsed cord. And I went off on that the other day. We have a prolapsed cord here, but you notice that this cord is not protruding through the vagina. It's not outside the vagina, but it is a prolapsed cord, isn't it? I can't see this one. This is why I had that rant the other day about, I think if I'm in charge of delivery, I should be able to do a vaginal exam. Because if you reach in there and feel a cord, you're like, oh shit, that's a prolapsed cord. We can't hang out. But if her contractions are less than 2 minutes apart and it's her third pregnancy, by rule, I would stay and deliver this, right? So let's just say I stay here for 10, 15, 20 minutes going to deliver a baby, and by the time I see something, it's a cord. What have I just done besides wasted 15 or 20 minutes, right? I've endangered everything. So I think this is a flaw in the concept. I think it's a flaw in the curriculum. I don't know the solution other than training you guys how to do vaginal exams. And I can't even get you into the OB ward now just to watch a delivery, much less go in there and say, hey, can I do a vaginal exam on you? I'm a student. Stares like, Stares like, you may not have an EMT class if you make us do that. But you get my point, don't you? Don't you think at some level of our certification we should be doing this? Do you think I should maybe call ALS for a vaginal exam? Maybe that higher level? I don't know where it's at. I'm just telling you, it could be prolapsed before you see it. Prolapsed before you see it. Please be aware of that. It's life-threatening for the fetus and must be treated at the hospital. Once again, I may not see it for a while. If I do see it, do not push the cord back in. Gloved hand in the vagina, push the presenting part. I'll say presenting part. They say head, like it's going to be the head. It could be the buttock. Push the head away from the cord. Gus, I'm going to pick on you a little bit. Okay. You're going to be 18 when you get your national registry. Your first call out of the box on an ambulance may be one of these. Gus, once you put your hand in the vagina and push the presenting part off the cord, it's going to stay there. It's not a one and done. It's a one and keep going. The book doesn't explain this. It does a terrible job at this. It ends right there. It ends right there. Transport rapidly. It should be a comma. Please consider the transportation issues you may encounter. What might those be? If I'm going to put her in a knee-chest position, if I'm going to put her butt up in the air, my hand's in her vagina, and I'm holding a baby off the cord, what are transport considerations?
You can't be seatbelted in.
You're not going to be seatbelted in, are you? You're probably going to be kneeling down beside the cot. Tight turns. Yeah, easy up there, buddy. Whoa. She moves, I move. I mean, come on. Okay, soft spots on the infant's head. I'm not supposed to press on those, so I would try my best not to press on those. So I've got to be aware of that. Good point, Hunter. What else? What are some other transport considerations?
It's a long transport.
I don't care if it's from here to the CTC building. It's a long transport, isn't it? All right. If it's that inclement weather, why I'm there to begin with. What else?
It's going to look weird.
It's going to look weird. You're really going to get to know this person, aren't you? I mean, it's going to look weird. You want to cover it up, but you're also assessing at the same time, right? For hemorrhaging and changes. And well, we'll be there in a little bit. It's like, have you picked out a name? Can Can you see Gus? I pick on Gus because Gus is young.
Oh,
Gus is
guy.
he is so calm and he takes it so well.
His
But
eyes
here's
are
Gus.
about this big.
Continue. I got to load and unload.
Exposure to the public.
Exposure to the public. I got to walk in the ER. Are they going to want to handle this in the ER? No. Where are they going to send you? Straight to OB, which is usually on a different floor. So let's ride the elevator 3 or 4 floors.
Nobody's getting in that elevator.
So you're going to get in that elevator. You're going to have the modesty issue, right? Protect privacy.
What if the news just so happens to be
Yeah, the news happens to be there.
So try and flip.
And then you're going to go home and talk about it. You're not going to believe what I had to do today.
Put a blanket over them.
And then you're really going to raise the alarm, right? It's like, what is he got under the blanket? Him walking through the hospital and... These are things that keep me awake at night. I'm going to teach about prolapsed cord tomorrow. How's that going to look? You should do these things. Okay, you should do these things, but I think it's only worthy that we have a conversation of how do I do these things? It's one thing to talk about it, it's another thing to do it. It's like, in there, give a radio report, and we've already found that giving a radio report is a little bit different. We've got to change frequencies, we've got to do some other stuff. So application of knowledge is the true learning. Spina bifida. Lots of kids have this. If I want everybody to do this tonight when they go home or go to lunch or go grocery shopping or whatever. I want you to pick up bread. I want you to pick up crackers. I want you to pick up wheat. I want you to pick up something that has flour in it. And it may just be flour itself. And who do I want to pick on here? James? Do you know what enriched flour is? Have you seen that term?
Yeah.
Enriched whole wheat flour. What do you think about it when it says enriched? Hunter, when you find flour that says enriched, what do you think? It's been made better? Sugar?
Probably shouldn't eat it.
Huh?
Probably shouldn't eat it.
Probably shouldn't eat it.
They've just processed it and taken everything, a lot of the stuff that was originally.
Well, to enrich something, you add to it.
Processed.
Folic acid. Folic acid. Folic acid. And your body takes folic acid, and if possible, if it can, it will break it down into folate. Pregnant women who lack folate are at really high risk, and these are called neural tube deficits. Neural tube deficits. The neural tube is the spinal column, the brain and the spinal column. Women without this folate in their diet or with neural tube deficits, and when this is one of them, spina bifida. Spina bifida. It's a neurotube development issue. Basically, the spinal cord or portions thereof are born or developed outside the body. So when you roll them over on their back, you see part of their spinal column. Do I have a picture of it? I do not. I do not. That's worth seeing. That's worth seeing. Give me one. Give me a real one. Here's one. That's a neurotube deficit. Spina bifida. Huh?
Spinal what?
Spina bifida. Spina bifida. I have and there are various stages. I mean, you can have really small ones or really large issues. This is not treated at TMC locally. This will be transported. This will be transported to a higher level facility, children's or something like that. So your federal government realized this because we were lacking folate in our diets, and so in order to ensure that we don't have these birth defects, our government, your government, our government has decided that we'll just put folic acid inside flour because everybody eats flour. And that's what enriched flour is. Sounds good, doesn't it? I think we're one of 2 countries or 3 countries in the world that does that. The rest of the world does not do that. And if you hear that, it's like, well, that damn sounds good because, I mean, I can just get it here and I don't have to worry about getting it in my diet. And but here's the problem. There's a large percentage of the population who cannot take folic acid and turn it into folate because of a genetic abnormality. This is off curriculum, off topic a little bit, but if you want to know more about this, then you need to research a genetic gene mutation that a large, like 50-something% of the population probably has, and if you get it from both of your parents, you certainly have it. It's the MTHMFR. Excuse my language a minute. All geneticists and doctors call it fucker gene because it is to have that gene. MTHMFR gene mutation. And you can't break down folic acid into folate. So that's why even if we have enriched this in our daily consumption in the United States, we still have incidents of this. Yes?
What more natural foods contain folate? Like how would people normally get it?
Through the foods, but our food supply is so lacking in that, and we eat such ultra-processed food that those folates are removed. But folates are found in animal products, some vegetative products, in a more natural state. This is an artificial way of doing it, and the method of putting it in your flour is relying upon your body able to convert it. Off topic, off curriculum once again, but there's a lot of research now that's showing that if you can't break it down, what happens to it? It builds up. And some people build up to toxic levels and some serious side effects due to eating it if they can't break it down. They can't methylate the B vitamin is the big issue there. And methylation of B vitamins is just now gaining traction in the medical community. You mention it to most doctors and they're like, huh? What? Because doctors aren't required to take nutrition courses to be doctors. I don't know if you knew that or not. If food is thy medicine, and some old guy said that, like Hippocrates, I think, said food is thy medicine. Medicine is thy cure. Now doctors don't even have to take nutritional deal. And the government's going to take care of it with folic acid. So research that on your own, do what you want to with it. The concept of doing it is to prevent spina bifida. Now, did that look like an issue to you? Mm-hmm. We're back on topic now. Did that look like an issue? Yeah, that's a birthing issue. You've got the nervous system outside the body. You've got infection risk. You've got neurodeficit risk. A lot of this can be corrected, but it requires surgical intervention at a high-level children's facility. So don't do that. Keep them warm, moist dressings. Okay, keep it moist, keep it sterile. Treat it like an open wound, but keep it moist. We don't want it drying out. Next one, multiple gestation, Frank. Twins occur once in every 30 births. You hit the lottery on that, didn't you? Twins are smaller. I would really like to know from her sample history, prenatal history, if she's going to have twins. That helps me. I'm certainly going to get another unit there because I'm about to max myself out. I've got twins. I don't know how this is going to go. But she's delivered, and she starts having contractions again. Well, that could be contractions of the placental delivery type, that third stage of labor, or it could be, hey, these are pretty intense, and her belly still looks relatively large. I don't think she's done yet. So always be aware of the possibility of twins. I hope I know, but I may not know. We always get off into these issues of, can a twin be born at a much later date? The possibility does exist. It does exist. Can the twins be from two separate fathers? And the answer to that is yes, they can. Not identical, but non-identical twins can come from two different fathers. I know that's a little wild for the course, if you say, but it can happen. People always are curious about twins. Each one of them gets their own time of birth. Frank, who was born first, you or your twin? You? By how much?
10 minutes.
10 minutes. So you fit the rule. You fit the rule. Who was bigger?
My twin.
Your twin was bigger. Stayed in the oven a little longer, huh?
Like a pound.
Pound bigger. They may be so small they look premature. Do you remember your birth weight?
Yeah, like 2 or 3 pounds.
Little guy. Luke, what were you when you were born? 19 pounds and 8 ounces. I was walking when I was born. I lit up a cigar and slapped my mom on the butt. No, how big were you?
I was 8.5.
Okay. Okay. Birth weight as a rule has been either going down or going up. Our median is changing. We either have these really high birth weights due to gestational diabetes or really low birth weights due to fetal alcohol syndrome or something. It's like, can we just get back into the mean? Our mean is getting messed up. Anybody big? Got any big babies in here? Were you a big baby?
I was 10.5.
10 and a half? Pretty big. Any 13 pounders? A 13 pound baby is, they happen, but they're big. They're big. They are big. On that note, after a baby is born and the weight is recorded, and let's say the baby's born 8 pounds, 8 ounces. It goes home with mom and it loses half a pound to a pound over the next 15, 20 days. Is that cause for alarm?
Yes.
No. No. Infants usually lose a little weight after birth because they're adjusting to a new system of digestion. They're not freeloading anymore. They have to work for the meal now. And it's normal for them to lose a little weight until they get back online and pull up.
It's like 15% of their body mass.
Yeah, they lose some weight. And moms notice this and get alarmed about it. It may actually call 911 just for that reason in itself. My baby's not doing well. It's losing weight. I don't know if it's eating enough. And they panic and they'll go in. They're like, no. Loss of body weight inside a parameter is normal in the newborn. Premature birth. So you were right around the norm. Around 7 feels good, sounds good. Before 36 or less than 5. Ding ding. What's a preemie? Before 36 or less than 5. Before 36 weeks or less than 5 pounds of birth is premature. I am always amazed at what these hospitals can do with premature infants and how early they can keep them alive and do well with them. And we're down to the size of the palm of your hand. They're doing this. If you ever get the opportunity to look at the medical equipment for premature infants, it looks like toys. It looks like something that doesn't really exist. They got these little bitty OPAs. I mean, little bitty OPAs and little bitty blood pressure cuffs. And the problem with the premature, ding ding, lack of surfactant. Lack of surfactant. It's a lung issue. It's a lung issue. They also do not have much brown fat. They don't have much brown fat. There's brown fat and there's white fat in your body. The brown fat is the fat that your body utilizes to keep you warm when you need to be kept warm. And so in the last month, the last few weeks of pregnancy, the baby will lay down layers of brown fat to help in its temperature regulation. And the premature baby does not have that. So if you do deliver a preemie, you're going to have two major issues. One is you've got to keep them warm. That's why you see the isolettes or the incubators. And the other issue is they're going to be really difficult to ventilate. You're going to have really poor lung compliance, even though the lungs are teeny tiny small. I look at these preemie lungs as an analogy. If I've got this balloon, and it's this big balloon, when it blows up, it's going to be one of those, it looks like they're relatively easy to blow up. You ever try to blow up the balloon, the really small balloons?
Like a water balloon.
And you're trying to blow them up, and it's like, but it's so small, how come I can't blow it up? If I analogize that to the premature infant, they don't have any surfactant, so their lungs are stiff but weak because there's no surfactant. So remember, surfactant was the soap, if you will, that's in quotations, the soap that keeps the water tension in your lungs at minimum. Without that, you don't have good lung expansion. They have artificial surfactant that they can use on that. There was a movie, and they were diving in that movie, and it's kind of old for you, I guess, but what was her name? And they experimented on it, and they filled the scuba suit, the dive suit, with this water, and they said, go ahead and inhale it. It's just like you inhaled for 9 months inside your mother's womb. And it was oxygen rich, and the person was inhaling it and kind of went through a choking episode and then kind of relaxed and like, this works. And that way they could super dive to the deepest portions of the ocean. It was kind of idolized as an artificial surfactant. So they have that kind of stuff in that technology, and that's what's keeping these babies alive. If they can make them breathe and get those lungs to working, they can do the rest. They can let the baby finish growing in the incubator, if you will. Nutritional support and this. So don't go through a delivery of a premature infant and think that because it's born so small and lifeless that something can't be done about it. That may or may not be true. May or may not be true. Very low vernix, less body hair, teeny tiny. Very tiny. I think in today's world they would consider that one they'd consider that okay in preemie world. That's big for preemie world. So do the best. With such care, premature newborns as small as 1 pound have survived. So that's pretty small. Post-term, you went too far. You're going to be big. You're going to have cephalopelvic disproportion. Once you go past term, these babies grow at a very exponential rate. I mean, they're like, oh, I love this. I'm developed and I am riding the train, man. I am getting big. They really start laying down that fat, and they look like little football players when they're born. And mom is in misery. Mom is in misery. It just will not fit. It will not go through the pelvic opening, the vaginal opening, often requires C-section. If mom does deliver it naturally, she is wrecked. She has major trauma, and before allowed of pre-hospital death in the early times. You will find now that most women are delivering their babies on the convenience calendar of their obstetrician. They tell you when you're going to have your baby to fit into their schedule. I have a delivery schedule tomorrow morning and one tomorrow afternoon. We'll get you in the next morning. Or let's go ahead and move yours up. And it happened with us with both of our kids. We go for a checkup. We know we're getting close, but she hasn't went into labor. She never went into labor with either one of them. I missed that experience. She missed that experience. I think that's a good experience, but we missed it. Most people do. They just go to their obstetrician and they'll measure and check. And then, okay, Kim, it's time for you to have your baby. I'm going to call the hospital now and get you checked in. And you're over there with nothing. You go, oh, I calling everybody, hey, it's today. And the process begins, and here's all the family. My personal experience with this, I love my family and love her family, but that was the worst part about the childbirth, was the family in the waiting room. I want to go in, I want to go in, I want to go in. And if there's anything post-COVID, they don't let people in there anymore, and that's a good thing, because the whole damn town would be in there if it wasn't for that. So I said something about those OB nurses the other day. This is where you're going to start loving them, because they'll keep it out of there. Fetal demise is a fancy word for death of the fetus before labor. So she is carrying a dead fetus in her. Sometimes they know this. Sometimes they know this. And depending on the circumstances, they may just elect to allow this woman to go into labor naturally, knowing that the baby born will be stillborn. There may be less risk to the mom. If she can do that, then there would be a risk of surgery and the complications that go with the surgery. You're in a new game now. You're not in a resuscitation game. You're in a patient management environment. Do not be surprised if names haven't already been chosen, clothes already been chosen, funeral arrangements already been made. They may or may not have a funeral. They may or may not. They may cremate, they may bury, they may do headstones, they may dress, they may swaddle, they may bathe. You're just going to have to go with that. You're going to have to go with what they want to go with and facilitate and help the family the best way you can. If the baby has started to decompose, it's going to smell horrific. If the water breaks, it's going to smell horrific. Just don't try to be a hero. Don't rush off to the ER. Say, I'm working CPR on a baby. And you get there and they're like, yeah, we knew this baby was dead 2 weeks ago. Any questions on fetal demise? I've never encountered it. I know it happens. I've heard the stories, read the stories, but I've never encountered it. But go with whatever plan they may have for that. Dean talked to you the other day. I had to step out and talk to someone. You talked about massaging the fundus, so we do that. Do not discard any blood-soaked pads. Nate, can you tell me why we wouldn't throw away any blood-soaked pads post-term? Yeah, they can test it, and they can also look at it and see if there's any tissue on it that might be part of that placenta. Remember, what could be coming out postpartum could be pieces of the placenta that didn't get delivered. And if we can put all the puzzles back together, then we're in good shape. If the mother complains of chest pain and shortness of breath following delivery, all women of childbearing age with sudden onset of chest pain and shortness of breath have what until proven otherwise? Pulmonary embolism. Put the shortness of breath in it. Pulmonary embolism. Is she of childbearing age? I think so. Does she have a sudden increase in difficulty breathing with chest pain? Yeah. Oh, it could be an embolism. It's probably not air. It's probably not fat. It's probably amniotic fluid. So that fluid that's around the baby, it doesn't mix with blood. It's like oil and water. So you'll get a bubble of that fluid. Is there a tear? Is there a source of entry for that amniotic fluid? Yes, it gets into circulation and can cause you issues. So,
Would I consider them septic?
not yet.
Could it lead to it?
If you got past this, yes. If you got past the life threat of what's going to happen is this bubble, if you will, or this blob of amniotic fluid is going to get in the vena cava. It's going to go to the heart. You with me? It's going to go in the right atrium. It's going to be flushed to the right ventricle. It's going to leave the right ventricle and go into the pulmonary artery. The pulmonary artery is going to bifurcate into the left and right pulmonary artery. And it's going to continue to bifurcate and continue to bifurcate and continue to bifurcate until it gets down to the capillary level in the alveoli. Remember that from August? At some point, this embolism is going to hang up. If it hangs up at the point of bifurcation to where it could go right or left and it kind of straddles it, if it straddles the bifurcation, like you're sitting on a seesaw, if you will, that's called a saddle embolism. But it's not a clot, so clot busting drugs will have no effect on it. They have to go in there and retrieve it. So she'll have to go to the cath lab and they'll have to go in and actually grab that clot with suction or something and get it out. It's life-threatening though.
Insurance be on blood thinners.
Huh?
Insurance be on blood thinners.
No, because it's not a clot. It's part of the fluid that was around the baby. Because she's torn down there, it got into circulation. Yeah, it's not a clot issue. It's not like somebody who's had a surgery and was confined to bed for a week. Or it's not somebody who took a trauma to the leg and broke off a piece of fat. Or it's not a bubble of air from somebody doing a bad IV start or something. It's amniotic fluid. And it will not mix with blood. You think it would go into blood and just kind of dissolve into it, but it doesn't do that. So be aware of that. Hallelujah, we're done with OB. Hallelujah, we're done with OB. Questions? We have a little time, so let's do the review at the end of this PowerPoint, and then we'll have a little conversation. We'll kind of plan tomorrow. I want to make the plans with you since you're involved. I think you have a right to these plans, and we'll make a plan for tomorrow and go from there. Cool? All right, let's see if we can get this. The first stage of labor ends. Billy? The first stage of labor ends when? Y'all agree? Hunter doesn't agree. Oh, you don't know, but you don't agree. Billy, Hunter, Billy, Hunter, go into debate. Go into debate.
I'm thinking of guessing this, and that's all she's picking at.
You talking to Billy? You talking to Hunter?
The sac doesn't always rupture though, right?
Sac doesn't always rupture.
I just think it's B.
You think Frank thinks it's B. Contraction or less. The first stage of labor ends when?
Always.
Glad we're doing the review. James, straighten them out.
Say B.
Luke?
Shit, I'll go C.
I think it is.
Hey, yeah.
A. We're going with A.
A.
Chas says A. You agree, Amber?
Yeah.
Amber agrees A. Riley? All the females in here say A.
Didn't say.
It's A even if it's Z, right? Yeah. Hunter, you good with A?
Sure.
Billy? Yeah. Onset of it. First stage is identified as onset of labor until it's truly the baby enters the birth canal, but you don't know that because we can't check. So if we can't check, we have to wait to see something. Oh shit, that's not what I want to see. Wish I'd have known 20 minutes ago. All right. A 23-year-old woman who is 24 weeks pregnant, they didn't have to put that part in there, with her first baby complains of edema to her hands, a headache, and visual disturbances. When you assess her vitals, you note her blood pressure is 160/94. Stare it. She is most likely experiencing
I think it's preeclampsia.
B.
Yeah.
Yeah.
Huckabee says, that sounds good.
She's not seizing, so it's not A.
She's not seizing, so it's not A.
Yeah.
You're rationalizing your decision. I like that. I like justification of an answer. What I don't like is making up stuff to justify your answer. I see that a lot in this business. It's like, well, it was bradycardia, so I gave atropine. Isn't that what you're supposed to do? No, it's Lance Armstrong, dipshit. He's good. He's Michael Phelps. He's Dean. I think Dean sets at 42. He hovers around 42 at rest. Does Dean need atropine? But it's bradycardia, and any heart rate less than 60 must be treated. Keep going.
It's not D, and I don't think it's C because they wouldn't.
I never talked about chronic water retention.
Yeah.
Okay.
I think you did. Yeah, I think you did, but it's talking about pregnant lady. And preeclampsia, you're still going to have that high hypertensive blood pressure. So
Okay.
it's B.
He says B. And he is correct. He is correct. Number 3, Riley, you're transporting a woman who is 8 months pregnant. To prevent supine hypotensive syndrome, how should you position this patient? Why?
I don't, like, personally, I feel like you should probably do position of comfort most of the time, or whatever seems right. But sometimes when we're answering these questions, it's like,
What seems right isn't?
yeah.
Yeah, okay, that's true. That's true. If you could do this by just what it seemed right, you wouldn't need to go to school. All right. Riley? D?
Yeah.
Because he said so?
No, I know you said one of the sides, I just don't remember which side. I think it's
I told you either side would work, but the preferred side is
left.
there is an anatomical advantage and an operational advantage. Vena cava being the anatomical, and the other advantage is she's probably going to be looking at me.
Remind me what semi-Fowler is. What's
It's
semi-Fowler
like
position?
Price is Right position.
semi-leaning up.
I haven't seen that.
You haven't seen Price is Right?
No.
It's like a recliner position, like semi-leaning up.
Oh, okay.
Stare it.
What?
I think it's a 45 angle.
I don't watch TV.
Good for you.
Remember shelter?
Good for you. I don't watch Price is Right since Bob left. I think it's
Not the
stupid
same.
now that Bob's left. It's not the same. Bob Barker? You know, I'm all for sheltered. I'm all for not wasting valuable time watching TV. But there are some cultural things you need to be aware of. And stare. I'm saying this with as much sincerity and kindness and love that I can. There are just some things we need to be aware of culturally.
Like Bob.
And I'm as guilty as anybody. There are just some cultural things that we have to be aware of to function in this business. And I've kind of warned you about this. You're going to be at a disadvantage because you're going to go out there and you're like, I don't know what the hell that is. I've never seen that before. And we all have something. We need to be as well-rounded as possible without being extreme. There's some music out there now that I don't listen to and wouldn't buy, but I have to know that some of these people are musical artists because I talk to people who know that they're musical artists. You know, that's my culture, that's my community. Bob Barker, Price is Right, is so ingrained in American culture since what, 1971 or 2?
Hey, I didn't even
Yeah, who
I
else
don't even know who that
else
is.
doesn't know who this is? I feel like,
I've never seen the
yeah,
Price
look
is
at this,
Right.
look at this. It's not just
Hey,
me.
Regan, I think it's us.
You didn't
I
say
think it's
that.
us.
I think y'all just old.
Yeah, y'all are just old.
So Sterrett, all this time I've been talking when I say this 68-year-old man sitting around watching Price is Right gets a high heart rate.
Yeah, I
You
have
didn't know
no
what I'm
idea
talking about.
you're talking about at all. I just, some TV show.
What about Wheel of Fortune? Do you
You know
know?
what that is?
Okay.
Is it that? Is it
No.
like that?
No.
No.
It just went off.
You've never seen them like
Spin the show,
Spin the big
spin the
wheel.
wheel.
I've seen
Have
it.
you ever watched Happy Gilmore?
I know about it, but I've never watched it.
It beats the crap out of Adam
The
Sandler.
Price is Right is when they spin the big wheel.
We've got,
Yeah, it's like a big wheel up on the wall.
I know American Ninja Warrior.
I don't know.
They try
I might
and-
have seen it like at a restaurant.
Some of those girls on there I like to build fence with, you know? Like they make a good
They
farmhand.
get a prize what's behind this door.
Okay.
Wow.
Okay. But there is something to that. There is something to walking into environments and kind of having to know what's going on out there. Mean you have to dive off in their subcultures. Just an awareness of it. Okay? Just an awareness of it. Just an awareness of it. But you're also challenged in another way, Sterrett. So when I was up here running off about the man watching Price is Right having a heart attack, one of two things in your head probably should have happened. Either you should have interrupted me and said, is this a game show? What are you talking about? Give me the correlation here. And put it back on me because that's my bad for using an analogy or an example that's not accurate. But at the same time, as your personal challenge is to go, what's up with this Price is Right thing? Why would a man have chest pain watching Price is Right?
Go home and
When you
YouTube.
said that, I was thinking, okay,
You took it in context.
Price is Right is just a TV show, so it'd be him going into cardiac arrest without any external factors.
Yeah, so you understood it.
Yeah.
Good. Okay, good.
I just thought
Use
that you were
context.
Well, here's the other thing. This is why you want to take an exam. This is why you want to take a high stakes exam that removes those biases. If I put that in an exam on a test question, your 68-year-old man was sitting in front of the TV watching Price is Right. He experienced a sudden onset of dyspnea with bradycardic heart rhythm. I'm leading you. I'm throwing something in there that doesn't need to be in there, for one.
and not be yelling at them, telling them your statement.
Yeah.
Yeah.
Like I do at Wheel of Fortune, like, why buy Val when the word is solved? I don't know why. I'm going to buy Val. Why buy Val now? Crazy people.
Anyways, the answer's D.
Some things you need to know about. But you don't want to take a test with that written in there. If you failed that question, there are faculty members in these universities and colleges and high schools who would give you a bad grade and you didn't pass the course. And you look at that exam and you're like, you messed them up. You led them down the wrong road. Okay? You had a non-valid test question. The registry will eliminate that. Immediately after delivery of the infant's head, you should do what, Frank? C. Assess the breathing effort and skin color.
Do you want me to guess twice?
Sure.
I don't think we're supposed to suction unless they're not breathing, like until they're like after. And we should just assess their breathing. It's important.
C looks good, don't it?
Wouldn't all these be happening?
And if all else fails, pick C. Do what?
Wouldn't all these be happening like simultaneously?
I remember something.
Why would you change?
I just remembered. I just realized that was.
Whoa, what?
I was just messing.
No, Billy, why? You said that. You said that, Billy.
Because
Why would you change it?
30
Because
No, I just remembered.
he started trying to justify his answer and he couldn't.
Yeah, I just remembered it was wrong.
You can change your answer if you can't justify it. Why is it wrong?
Because they're not going to breathe yet.
Okay, they're not breathing yet because their chest is still in the birth canal.
Yeah.
And so then what are you going to do?
Suction.
Oh, delivery.
Okay, now it's down to A and B. This question should never land on a good exam. This question should never land on a good exam. If it does, we need to redo it. The correct statement for this would be suction as needed. Okay, let me give you a ding ding with an asterisk. If this ever did make it onto an exam and you couldn't do anything about it, like you can't go back to the professor and go, get that question out of there, it's stupid. You can justify to me why it's stupid, I'll remove it. But I have statistics that will show me, and we're going to get into that as we start reviewing for the final. But if this was to make it on an exam and you had to answer it, M comes before N in the alphabet. Mouth, then nose.
Yes.
Mouth, then nose. I'm going to flip this slide, and if they got it wrong, I'm going to throw this remote. This is trivial. This got stuck in the curriculum. Did you see anything on that video yesterday where the guy was suctioning? Did he go mouth, nose, or nose, mouth? Did he say anything about it, or did you watch? Or he just did it, didn't he? He just suctioned.
Mouth and then kept going.
He just kind of suctioned, didn't he? As needed. Did the baby live? Congratulate the mom on a healthy baby boy.
Throw it. Throw it.
It's not even out yet.
Frank!
I didn't pick my second answer.
Was that your second answer?
No.
No, you didn't throw the
See,
remote.
I thought it could be D though because immediately.
The reason I didn't throw the remote, I'll live with that.
You gotta leave.
I'll live with that. I will live with that.
Can you not do
Wait.
like all these
Well,
at
the
once?
heads-
Question, but I thought you're not supposed to stick nothing in there unless,
Unless you need to.
yeah,
No, but if
But
it's
but what is the correct answer?
throw it,
D.
then loosen.
D. So the question is good. It was misleading to me because of my old bias that we used to test people on mouth, nose, or nose, mouth. We used to test people on that. So my bias said, I bet they're wanting one of those answers. Actually, it's a pretty good question now. Now it's been justified to me by the author by saying, hey, you got a head out. You better hope there's not a cord there with it. I missed it too.
I don't like the word.
How did I miss it? I'm supposed to be a subject matter expert, so they say. Which there's two things wrong with that. Subject matter and expert. And I'm not an expert. Nobody's an expert. Don't ever claim to be an expert. I'm probably as qualified as anyone in the room to answer the question. I'll grant you that. And I missed the question because my bias took me down this road. Billy or Frank, you said breathing effort and skin color. Your bias is, let's assess that airway. Let's see if they're breathing. And you say, oh, they can't be breathing. They're in there. Statistically, this question would fail because I missed it. That's called discrimination. This question did not discriminate against a high performer. I'm not bragging, but I'd be the high performer on this test, wouldn't I? Okay? It didn't discriminate between the high performer and you. And in this case, you would be the low performer, relatively speaking. Is that making any sense at all? So this is not a good question. It needs to be fixed. It's got inherent bias. It needs to be massaged and worked and changed over. So I'm going to challenge one of you. Billy, you spoke up on this because you didn't want him to change his answer. How would you rewrite that question to make the objective true, to get the right answer out of someone like me? How would you change that question?
I don't know, I misread it and I thought the whole.
Okay, how would you fix the question to make it a good question? Because we've identified it's bad.
I guess after complete delivery,
I would change
not just the head, but the whole body of the baby.
I would change the choices because they're misleading.
Yeah, the choices you see too that are the same and it kind of throws you off and you're gonna think it's one of
That's what I did.
Also, how are you going to check the position? It doesn't seem like I could check the position. Like, if it's not even supposed to be
Yeah,
there.
I would say just do a quick immediate assessment because, I mean, you're not going to check the position of the umbilical cord if it's not
It's not
there.
even supposed to be
If
there.
it's around the neck, you're going to help and remove it. If it's not there, you're not going to.
You don't work that. If you don't see it, you don't see it.
Like testing for a really, like something kind of rare.
You wanted to rephrase the question?
Yeah, rewrite the question and make it an umbilical cord question.
I think it'd be immediately after delivery of the infant's head, and baby's breathing has not established. You should, because that kind of knocks out C, and it's like, well, if he's not breathing, then maybe it's because D, the umbilical cord, trapped around the neck.
Here's what I would do. I would say immediately after delivery of the infant's head, you should check for
You should
blank.
assess and
Okay.
And then like check
You're
for
kind of
breathing.
going where I,
Check for
my thought on this would be,
And then
It's kind of a no-brainer too. If you use one, you're gonna do something.
yeah, if I throw it out too easy, it makes it really easy, don't it? If I throw the umbilical cord stuff out there. Which of the following should be checked upon delivery of the head?
yeah, that's better.
And I could make a laundry list, couldn't I? And the registry does that now. Pick 3 of the 5. So give them 5 options. Pick the 3 correct ones. And I could check need for suctioning, position or nuchal cord. I could just say nuchal cord, and that tells me, hey, I'm checking to make sure there's not a cord around the neck. And explosive delivery, because I want to prevent an explosive delivery. Right, the head's already out, now it's going to get really easy, so I want to prevent that. Okay, or do not turn head or something.
With National Registry, say it has 5 different things, says check 3, and you get 2 of them right, 1 of them wrong.
You missed
Give
it.
you partial credit?
Nope,
or-
no partial credit. At the EMT level, they don't put a lot of those questions on the EMT. Now at the paramedic level, it's drag, drop, rank, multiple answer, stuff like that. I did that little exercise with you. Do you see how hard it is to write a valid test question? Okay, so I have no sympathy for anybody who's using publisher questions. They're not good professors. And you're not passing or failing the course under merit. And if you ever go into the fire profession or EMS profession and you're taking promotional exams, I know people who have went to court over one question. And he won. And it was a $40,000 a year question. It was a career question. He won because validity and reliability of that question could not be established.
You know what the question was?
It had something to do with ground ladders.
You got a $40,000 promotion? What department is this?
Plano.
What is this going? Is this from driver to captain or what?
I don't know what position it moved up, but the implications were large. And their career changing.
Yeah.
Their career changing. Because the next promotion is based upon that promotion. If you do 2 of those in a year, it adds up really quick, doesn't it? If you go from driver to captain to battalion chief or something like that, it would be significant. So always check this stuff. Always check this stuff. The exams you take in here, I have the statistics behind it. So the reliability statistics. Number 5, on delivery of the head, you note the umbilical cord is wrapped around its neck. Frank, let's go back to you. Chance to redeem yourself. You should.
It's not D.
It's not D.
Yeah.
Not yet.
Give me a minute. I was gonna say B. That's the first thing you should do.
It's not CFB.
If you can. I think you should wait for the baby to be delivered.
They're all plausible answers, aren't they? By plausibility means they all could, I guess that, yeah.
It's B, it's not A or D and C. I remember ever hearing about that.
So it's not, why isn't it cut and clamp? You can cut and clamp.
Just not yet. You gotta.
Not yet. Okay. Shit. Calm down, Frank. Easy.
Or someone else answer. answer.
What's C? What's wrong with C? Keep it moist and transport.
The baby's gonna keep
Keep it
coming.
moist as
You gotta wait for the baby out first. You can't.
Okay, you're not doing anything to help the baby with doing that, are you?
The baby's important too.
What's wrong with high flow oxygen transport? I mean, if all else fails, give oxygen. That's what they say,
Who
isn't
are you
it?
giving the oxygen to?
Oh, look at him. Who are you giving the oxygen to, mom or baby? Not baby, because baby's cord's in a bad position. How about me just try to remove the problem, right?
Yeah.
Slip the cord off. Frank, if it's not B, I'm going to go buy you lunch right now, okay? Damn it. Frank's like, damn it, I wish it was D. We'd have got a lunch out of this. Good job, Frank. You justified your answer. I like that. All right, let's see. James, don't hear much from you. The need for and extent of newborn resuscitation is based on... This is a tough question.
D.
D, as in dog?
Yeah.
Why?
I guess you gotta do your triangle. Yeah, where you have to go to go down. I mean,
Frank, you agree? I saw a negative. Chas has got a
I
negative.
can't completely justify it.
You can't justify his answer?
Not completely.
Not completely. Chas, can you justify his answer?
I don't disagree.
You think it's B, the age of the newborn?
Gestation age.
I think it's A.
Yeah, I
Because
think
that's
it's
what we actually would do. You have to do the APGAR score, and that would depend on what.
You think it's A because that's an assessment tool we use, but it's at 1 minute.
It's asking for resuscitation, not all the other stuff.
going to.
Basic question, not the.
The A or D.
Starrett, I'm going to say this in front of everybody. Not to pick on you or say anything to you about this. I'm saying it because there may be other people in your position. And ironically, I recognize this in people. How'd you describe yourself one day? When I said, you don't know what crack cocaine does on a blah, blah, blah. And you were
Sheltered
like,
Christian kid.
there you go. So say it again.
Sheltered Christian kid.
Did you say you were homeschooled?
Yeah. Oh, that adds on to it more.
Okay. You were obviously a homeschooled Christian kid who did his homework and not sit and watch Price is Right and get a free day out of school. So love it, granted, and I'm sure your education far exceeds a lot of public school education. How did you do the entire public school homeschool, or did you go go back
all
into
12
this
grades.
all 12 grades at home? What that has done to you, other than making you very, very good at knowing the material. I bet you know that K-12 curriculum better than anyone in here. I would bet on that.
Guarantee it.
I would bet on that. Okay? And this is coming from a lot of people that I know who teach in K-12. And that's not knocking fun at them. It's not knocking them at all. They have a job to do and they do the best they can. But you were focused, your parents were focused. What that has done for you, and then if there's any negative to that, is it's a black and white world in your book. It's very binary. It's 0 or 1. It's right or wrong. You're and so when you look at a question like this, and you see the need for extent and newborn resuscitation is based upon, and you're in your mind, you've picked the assessment. Who wouldn't?
Well,
Who wouldn't pick the assessment? That's the assessment that they're. But I said something, and the book did too. This is often done retrospective. So go ahead with your statement.
so, I mean, in a real situation, I'm going to treat as needed, help the patient. But in a question like this, you're trying to get the question correct. And like even with like that last question, it's like if there's a cord around the neck, you're going to take the cord off. If there's no cord, then you're going to clear the airway. So I'd be solving to get the question right, and not maybe exactly what I would do in an actual situation.
We don't know the correct. I haven't identified the correct answer
Yeah.
either. The need for and extent of newborn resuscitation. And you picked A, and James, you picked D. Why did you pick D? That's,
Because D is your APGAR score.
it is your assessment, isn't it?
If the baby's not like responding to me gently pulling on its legs, I'm worried about its respiratory heart rate. And
Okay.
before I worry about-
Please understand I wasn't picking on you, but no, man. And thank you for allowing me to use your bias as an example of where that could be a stumbling block. Because I see it. I see that that's the assessment I taught you. But like James says, that's at 1 minute. That also includes 2 other things, and I'm not going to see if he'll hold his leg down before I attempt a resuscitation. It needs to be more immediate than that. Everybody follow what I'm getting at? And there are just some people. I had an engineer in a class. My very first class here, I was helping in the paramedic program. I had an engineer in the class from Ford Motor Company. And that was in 2003, 2004. He left Michigan, moved to Texas for a career change. He wanted to be a firefighter in Plano. For whatever reason, that's what he wanted to be. He was the engineer on the F-150 in 1997 in the redesign of the Ford F-150, and he engineered for 2 years the right-hand exhaust manifold in the 4.6 liter engine. That was all he did for 2 years. He calculated the amount of metal it took to build it, the cost to build it, the mechanic's ability to go in there and change it if need to change it, durability test, all this stuff. Took over 2 years. He was my most difficult student to be so bright. He was a genius. He was so engineering-wise a genius. I like to never got him through pharmacological math and how to do drug calculations. It was a different problem from what he was trained to solve. Like, how did you design an exhaust manifold but not tell me how many micrograms of lidocaine? It's like just the programming of the brain. When it was plastic, when it was neuroplastic, when it was moldable like you did in your upbringing, there were some things that were left out. Turn to a public school student, there were some things that were left out. They got neuroplastized by something probably less than. So it's not a default, it's not a fault, you just need to be aware of it. Need to be aware of how I approach a question. I need to look at it a little bit deeper. So your gut reaction was great, but you would have missed the question.
Yeah.
Damned if you do, damned if you don't, right? Yeah. And we all agreed you were probably the brightest kid in the room, but no. The 1 minute APGAR score, let's try this then, Sterrett, and let's get you out of here. The 1 minute APGAR score reveals the baby has a heart rate of 90, pink body, blue hands and feet, rapid respiration, cries. You ought to do well at this one. This is just assigning numbers to the game. I'm going to give him a 2, 4, a 4, and a... No, I'm going to give him 1, a 2, a 4, 5, 6. I think I have my answer. See, I suck at these questions.
Okay.
You got your answer?
Yeah.
What is it, Sterrett?
6.
Yeah.
Everybody else get a 6?
I know it's 8. It's 8 because it doesn't have that. Yeah. It's 8.
Yeah, I was 8.
Yeah, I know. It's
Well,
just the rapid.
you could start at 10 and back it out if you wanted to. That may be an easier way to solve it.
Yeah, that's a better way to do it.
So let's start at a 10 and let's take away 1 for the heart rate.
Yeah.
Now we're at 9.
1 for the blue hands.
Blue hands, acrocyanosis. Now we're down to 8.
Yeah. The next one had.
Rapid respirations. I'm good with that. Cries when feet are flicked and resist attempts to straighten his leg.
That keeps 2. Baby cries.
So
Resist.
I'm going to keep that 2, but I'm going to remove 1. Cries when he flicks the soles of his feet. Isn't that -1?
Yeah, that's a response.
No, but is it a strong? Is it a strong cry or a weak cry?
See, this is where I go, what the whatever. I'm going to go back here with James. James is like, man, does he look good? If he looks good, we're in good shape. You're going with 6 now or 8?
I'm gonna stick with 8. I think the 3
Yeah.
is fine.
8?
Because newborn
8?
cries and is reflexive.
Yeah.
It's
8?
2.
I would have missed the question. I was going with 6.
Let's see. Yep.
Mhm.
8.
Score.
You redeemed yourself, Starrett.
Well,
You stumped the chump. Stumped the chump. The most effective way to prevent cardiopulmonary arrest in a newborn is to do what, Amber?
C.
C.
You don't want it hypothermic.
Nate,
don't
you
want
agree?
to rapidly change your body temperature.
You going with Amber?
And you don't want it to start at its rate anything less than 100.
It'd be less than 60. We don't want to increase its body temperature. We want it to just not get cold.
Yeah. Again, you don't want it to
And we
start
certainly
rapidly
don't want it to be
fall.
hypothermic.
And again, you wouldn't rapidly increase the body temperature, period, even if somebody as an adult was hypothermic.
You going with C too, Nate? Good, good. Number 9, while assisting a woman in labor, you realize her vaginal area and see an arm protruding. She tells you feels the urge to push. You should do what? Drew? What do you want to do, Drew?
Yeah,
Hunter? Hunter's like, this calf ain't coming out right. I'm gonna bury up to my elbow in here and get me a foot. give me the chains and the winch, boys. Get that 4-wheeler started. We're gonna pull this thing. A.
B, C, and D are what not to do.
Yeah. Number 10, Luke. Newborn's considered to be term if born after and before. Trivia, right? Trivia.
20 on B. B, yeah.
B?
My money's on B.
Money on B?
I'm not changing my mind either.
Oh! I'm not, am I?
Yeah, it's B.
I'm not, am I?
The slide said 41 though. It's
Post-term doesn't count as term, does it?
Term post. Term plus.
So no.
Good job. Not changing my mind either. All right, so here's what I have planned for tomorrow, and you can add or subtract or tell me I'm stupid. How about